Officials still keeping a very close eye on 50 people for any possible signs that the Ebola infection is spreading. That number cut in half since yesterday. So far, no new cases have been confirmed in the U.S. Tonight, our Adam Weiner is taking action, finding out just how easy the virus is spread and why experts say we have nothing to worry about in the Bay Area. Adam?
That's right. Many local hospitals tell us if an Ebola patient showed up, they would be ready, but they are also learning hard lessons, closely watching that situation in Dallas.
Dallas people in the Dallas Presbyterian Hospital really kind of dropped the ball on this one.
Letting an Ebola-infected patient leave the hospital was a mistake, says the chair of USF's Department of Global Health, but he also believes it's serving as a wake-up call.
But I can guarantee you that everybody in the nation now who's showing up in an emergency room with a fever and diarrhea is being asked the question of what your travel history is. Did you travel to Guinea, or did you travel to Liberia, or have you had any contact with any person who's been there recently?
The global health expert Dr. Thomas Yunash does believe the CDC is responding well to the Texas crisis.
So in a situation like this, you really want to go to cast the net as wide as you possibly can, because the last thing you want to do is miss somebody.
More Ebola will likely be identified in the United States, says Dr. Yunash, but he doesn't think Ebola will spread as easily as, say, the flu.
The flu is an aerosol one, so if somebody sneezes, you can pick it up 3 or 4 feet away, 5 feet away. Ebola is not like that. Ebola, you have to have a direct contact. With this thing, you actually have to have basically what appears to be direct contact with their bodily fluids to be exposed. So as long as you're not in direct contact with a sick individual or something that the sick individual's got its bodily fluids, their bodily fluids over recently.
And there are many in our community who are being directly affected by that Ebola outbreak in Africa. We're right now on the University of Tampa campus, where we spoke one-on-one with a student recently back from Africa. She is fearful that her family back home in Liberia could be threatened by this Ebola outbreak. We're going to hear from her tonight at 6. For now, we're live in Tampa. I'm Adam Weiner for ABC Action News. Back to you.